Hello, I'm Cathy Petersen, a volunteer with the Dayton Area Chamber of Commerce. You are watching Business Connection, a program produced by the Dayton Area Chamber of Commerce. The Chamber is committed to finding business solutions by collaborating with regional business leaders on key issues. Our guests today are Jeff Mullins of Taft Law, and we also have Paul Tambe of BW Employee Benefits. Our topic today is something everybody's talking about. It's the Affordable Care Act. I want to thank both of you for joining us today to talk about this important issue.
You're welcome.
You know, the Affordable Care Act passed in 2010, and it's undoubtedly one of the most important landmark pieces of legislation in the history of the United States. Almost 3 years after its creation, there's still a lot of questions out there. Today, we're going to focus on what the Affordable Care Act means to businesses. So, let's get started. What are some of the misconceptions that businesses maybe have about the Act?
I think there are several. Unfortunately, there are very many misconceptions about the Act, but if I had to narrow it down to four, I would say first, some employers say, I'm under 50, I'm a small employer, so this won't impact me. At the other end of the spectrum, some employers say, I'm a very large employer, I provide great benefits to my employees already, so this isn't going to impact me. We also have a number of employers who believe that the best strategy is to take a wait-and-see approach. Let's see what happens in 2014 before we begin to plan and strategize. And I think the last misconception that we see a lot of is people who believe that the Affordable Care Act means that you have to provide health care for the employee and their family that is affordable. And actually, the Act just focuses on the employee. The affordable means affordable for the employee, not necessarily for the employee's dependents or the employee's spouse.
And Paul, is there anything you'd like to add on that?
With regard to the misconceptions, most of the clients that we have and employers out there, they truly don't see necessarily what this community rating is going to do. And one of the misconceptions is they think that, okay, there will now be a place to buy insurance, it'll be very affordable, and when employers go to community rating, about 70% of them will see significant increases.
Now, looking at some of the other aspects, when do the different provisions of the Affordable Care Act go into effect?
Okay. Some of the provisions are already in place. Okay. The biggest components come into effect January 1, 2014. That would include the pay-or-play rules, which we'll talk more about, as well as the anti-discrimination rules. Other components and provisions will come into place over time all the way out to 2018 when the tax on Cadillac plans will come out.
Okay. Now, although employers are not required to provide health coverage to their employees under the Act, employers of a certain size will be subject to employer shared responsibility provisions of the law. You know, there's a lot going on here. Now, can you explain what does that mean to businesses?
Generally, what it means, the pay-or-play decision means that employers who are large employers under the Act, and those are employers with 50 or more full-time equivalents, those employers are going to be required to either provide insurance to their full-time employees or pay a penalty. So they're not required to provide the insurance, it's just that if they don't choose to provide it, they'll have to pay a penalty. And basically there's two types of penalties that employers can be required to pay. If an employer says, I'm not going to provide any health insurance at all to my employees, I'm getting out of the health insurance business, then the penalty is your total number of full-time employees minus 30 times $2,000. On the other hand, some employers will say, I'm going to provide benefits to my employees, but those benefits may not meet the requirements of the Affordable Care Act. And if an employer goes that route, then they have to pay a penalty that's $3,000 times the number of employees that they have, full-time employees, who go to the exchange and receive what's known as a subsidy for buying health benefits. And so those are the two different types of penalties that come into play. And the only people that this will impact are the people that are over 50 in their number of full-time equivalent employees.
Okay. Anything else, Paul, that you wanted to touch on with that?
With regard to the full-time employees, the number is 50, okay, full-time equivalents,
Okay.
and part-timers and their hours are used with a formula to calculate if you're over 50 or not.
Okay.
So we could have a situation where you have an employer that doesn't think that they go over the 50 because, well, we only have this many full-time employees, but any significant part-time force can tip you over the 50 mark.
Now, you touched on this a little bit, but just to clarify, will all employers, regardless of size, be impacted?
Yes. Okay. Very large employers will be impacted to a lesser degree than smaller employers under 50. The smaller employers will be impacted substantially because for many of them, they will have to continue benefits to attract and retain quality folks. When premiums go up for that group, there will be a significant increase for many of them because we will be going to community rating. And community rating is different. It's got, there are currently about 48 different ways where one decides premium and costs. Under community rating, that goes down substantially.
And it's that's sort of a sleeper, if you will, in the Affordable Care Act. Everybody's talking about pay or play, but there's not been a lot of discussion about what happens when we go to community rating. And the community rating, I think there's some estimates coming out of the insurance industry that alone, not taking into account additional fees and taxes that are going to come in, but that alone could represent a 30 to 50% increase in premiums. And it's really because we're not just looking at, what we used to look at was the experience rating of the employees who work for this company. And that's why people would have to fill out all those forms and submit them, and then you would get a quote. Now, under the community rating, they're not going to be looking at the experience of this company. They're going to be looking at your community. And when you look at that, that's going to take into account a whole bunch of people that aren't currently on the insurance rolls. And for some of those people, the insurance companies are expecting a very high cost of providing care to them. So that will, almost ironically, those small employers who say this won't impact me, I'm so lucky I'm under 50, actually those employers may be more impacted by the Affordable Care Act than anyone else.
You know, when we talk about the Affordable Care Act, you hear a lot about exchanges, and I think you both mentioned them. Can you explain that concept?
Sure. Exchanges are a place where folks, employees, individuals, as well as small employers, will buy insurance. Some of it will be done online, and they will be run by either the state, the federal government, or a combination thereof. For Ohio, it will be a federal-run exchange. There was also shop exchanges, which are set up for smaller employers on a group basis. Those have been delayed till January 1st, 2015.
Okay, because my next question was, will small businesses be able to purchase the health coverage through the exchanges? And you touched on that a little bit, but can you expand on that a little bit?
Sure. Small businesses will be able to buy, and particularly through what's going to be called the shop exchanges, SHOP. But I think our expectation is that most small businesses will not want to do that if they can avoid it, because of the exchange will use the community rating system that we've described. Several of the insurance providers are coming up with new plans for smaller employers. Some of these are called a hybrid self-insurance or a modified self-insurance, where Normally, you weren't allowed to self-insure your employees unless you had 150 or 100 employees. Paul, I know some of these numbers have gone down, I think, into the 25, 15 employees. So small employers, if they can, will probably want to try to find health insurance products on the private market if they can, and I think the private market is responding to this.
Yeah. Then there will also be new products developed by the insurance companies, as well as things like MIWAs, Multi-Employer Welfare Associations, where smaller employers band together to try to realize some economies of scale with regard to purchasing their medical insurance.
We hear a lot of reference when it comes to the act of full-time employees. What is considered full-time under the act?
Full-time employees under the act is 30 hours, which is another one of those misconceptions. Many folks view full-time employees as 40 hours or pick a number, but under the act it's 30 hours. And there are two different reasons you look at full-time employees. One is just to see if you're over the large employer number, 50 or more, because in theory, a company could have 35 full-time employees working 30 hours or more. They could have a whole bunch of part-time people, and when those hours are converted, they're over the 50 threshold, they become a large employer, subject to a penalty potentially, somewhere in excess of their first 30 folks. So those are the things that we have to be careful when we're talking to folks.
We're thinking a lot of people are going to have to change, their handbooks. A lot of people have definitions of employees that won't match up with the definitions that are in the Affordable Care Act, full-time being one of them, but there are also there's something called a variable hour employee. And full-time employees right now, if you're a company after 2014 and you hire someone and you know they're going to work more than 30 hours a week and you reasonably expect them to, those people are automatically, they have to be covered within 90 days of when you hire them. You can still have a 90-day waiting period. But there's another situation where you're looking at your existing employees, people you already have. There's going to be a look-back period where you go back a certain number of months and then come up with the average and see if it's higher than 30. If it is, you have to provide coverage to them. There's also going to be a group of people called variable hour employees, and these are employees that will either go up or down, or who you think are going to consistently be under 30. And those I think in some industries will be the most problematic employees to deal with because one, some people question whether they're really variable or not depending on how you hired them and what you intended to do with them. And anytime you get into people's intent or reasonable expectations, there's a lot of room for interpretation. But also somebody's going to have to watch all these employees that come in. One starts here, one starts here, one starts here, and keep track of some sort of a period of time and then calculate the average and determine whether they're eligible. So I think that's going to be a record-keeping requirement that's going to be difficult for many employers.
It's such an important education process for our businesses, whether no matter what the size is. We've heard some in the media that some employers are maybe suggesting that they're just going to eliminate health insurance benefits. Really, what are some key things that employers need to keep in mind when they're, going through that decision-making process of the pay or play determination?
Right. Employers have a lot of things to look at, and the first thing one would look at is, am I a large employer or a small employer? Let's say you're a large employer, meaning over 50. Before one says I will pay the penalty, they really need to look at it and determine what are they going to get for that penalty. One of the other items that's very large is the fact that the penalty is non-deductible. So a $2,000 penalty per person or a $3,000 penalty per person, when one adds tax back on it, is a big number. The second piece is, how do I keep my quality folks who desperately want and need medical insurance? If it simply goes away, they may lose that employee, okay? On the flip side, with smaller employers, the key is how do I continue providing benefits in an affordable manner? And one of the things I think employers need to look at is, we see a lot of folks saying, gee, I'm going to stay under 50. if they have to continue providing benefits, they may actually want to get over 50 to get away from community rating so that their policies will be rated like they currently are.
I've been amazed when I've worked with people like Paul who can sit down with an employer and calculate all these numbers. When you look at the penalty that you'd have to pay, either the $2,000 or $3,000, and you gross that up for tax purposes, not getting a deduction for it, and then you remember that you can still charge the employee like 9.5% for their share of the health care benefits. If you have an employee making $20,000, that means you can come up with roughly $2,000 from the employee. Add that to the penalty, gross it up for taxes, and remember that you only have to cover the employee, not the employee's spouse, and you have to offer coverage to a dependent, but it doesn't have to be affordable. What you're really coming up with is a minimum plan that provides essential health benefits to the employee, and usually you can do that for an amount of money that makes more sense than paying the penalty.
Wow, big decisions to be made. You know, the law specifically is designed around health benefits, but can you discuss the payroll reporting and other HR components that employers need to know about?
There are quite a few of those. The biggest with regard to reporting of payroll is for 2012, large employers with over 250 W-2s were required to report employer-paid healthcare premiums on the W-2. For 2013, unless repealed, all employers will be required to calculate and put in the premiums. And that's not an easy task because premiums change. You may change your coverage from single to employee and spouse. You may take off a child, add a child, things like that. In addition, summary of benefits of coverages is another HR compliance item. Those have to be distributed to employees. That was done in 2012 requirement. Big penalties on these things. Notice of exchange when they're out, and when employers have to provide notice to their team. Am I missing any?
And if someone elects not to take your coverage, you've got to provide them with a notice as well. But there are going to be a number of sort of what I would say payroll and accounting responsibilities that employers will take on. And if they don't perform these correctly, there's a potential penalty of $100 per day per employee up to $500,000. So there's certainly an incentive to understand these, and I think what we're also going to see is people are going to be relying more and more on technology to track all these things, going with a payroll company that, you know, somehow all of this is almost automated, so that I think you would end up you'd have to have a department of people that would calculate all this if you're not able to rely on technology. So I think most people will go that route.
Right. It seems with most things that's what we're doing these days. Now, the state of Ohio has decided not to implement the Affordable Care Act, but instead is deferring implementation to the federal government. Now, how is this impacting Ohio employers?
First, you know, we see most of the small employers potentially going to the change. It would be a smaller employer. For the most part, we don't see a lot of employers going there. I don't see it has a big impact on employers. On the individual level, federal, state, or a partnership, the folks who qualify for the exchange would most likely go to the exchange.
What's probably the hottest issue right now at the state level is what are we going to do with Medicaid expansion? Governor Kasich has indicated that he believes we should expand Medicaid coverage, but others in the House and the Senate disagree. For employers and employees alike, this is a significant issue because right now Medicaid covers a relatively small group of people. This would enlarge that group many times, and employees who qualify for Medicaid coverage, they could obtain coverage through Medicaid for free. They don't count toward either of the penalties that we've discussed. So if you have an employee who decides they want to take Medicaid, they won't count as a penalty if you're not providing them with insurance. But also those employees who take Medicaid go off the employer's rolls. So if you're a self-insured employer and a number of your employees are eligible for Medicaid, and they look at the plan, even the affordable plan that you're providing, and it's going to cost them $2,000 a year for that plan, but alternatively they can get Medicaid for free, they're very likely to go for that, and then they will come off of your plan and won't have to be a part of your experience and your expense. So I could see, if this goes through, I can actually see some employers trying to really educate their employees on the availability of Medicaid. I also know to a number of employers in Ohio, particularly the hospitals, who right now are required to provide free indigent care. The idea that a lot of people who are receiving that care would be Medicaid eligible, that's very important to the hospitals because they're taking certain cuts under the Affordable Care Act already. This would help offset those cuts. If it's not there, that's going to be a tremendous expense on a number of the hospitals. We have wonderful hospitals. We're blessed with some of the best hospitals here in this area, but this is going to put an incredible burden and strain on them.
Absolutely. These are incredibly important, decisions that employers must make. What is your advice to employers? I mean, obviously it's confusing.
Sure.
What would be your advice?
Our advice is this: no two employers are exactly alike. They need to develop a strategy, be very proactive because the clock is ticking very quickly, and they should work with professional advisors who can keep them on track, and again, be proactive and start soon.
I think that's key. What Paul just said, you have to be proactive. Taking a wait-and-see approach really could be disastrous. You want to make the decisions here yourself. Do you want to be a large employer or a small employer? Some people are on the bubble and have that decision to make. If you're a large employer, how do you want to provide benefits? If you're a small employer and you still need to provide benefits, how are you going to do that? But these are all things, for a lot of employers, healthcare costs are either the number 2 or the number 3 expense on their ledger. And if there's going to be a big increase in cost on that expense, that could have a tremendous impact on the business going forward. So being proactive, learning a little bit about how the Act works, and I realize it is complicated and confusing, but learn enough about it that you can make well-informed decisions and consult with, people should be talking with somebody right now about this issue, because you can't wait until September or October, because some of the things that you might want to change right now are actually, we're in the window of opportunity to change those things, and that window is going to close in some instances within the next month.
Where would you suggest? I would imagine that some of the larger employers maybe have their own team, working on these issues. But if I'm a small business, where do I turn to get some answers?
Well, the local chamber, the Dayton Area Chamber, has a lot of good quality information there. They also have a list of advisors that they can use. And we think that that's a good solution.
Absolutely. The Chamber is always very thoughtful in helping its members and just, making sure the businesses are successful in our community. Anything else that you'd like to add? A best of luck to our businesses.
Yeah.
Yes.
Best of luck. That's
Best of luck.
Thank you both so very much for talking to us about such, an important issue for our businesses and really everybody in our community. Thank you.
Thank you for having us.
This concludes Business Connection. I'm Cathy Petersen, your host, and we appreciate you joining us today. Now please stay tuned for a special message from the Dayton Area Chamber of Commerce.
As the dates of implementing the Federal Affordable Care Act are getting closer, too many of our area employers and their employees still remain unsure of how they will be affected. What started out as a fix to reduce the higher cost of health care and the simplification of access for more of our citizens may be turning into a bureaucratic mess that may not reduce costs at all, and for many may increase the cost of health care insurance to even higher levels than even previously expected. This is a complex issue without a doubt, but employers who once thought this could be an opportunity to lower costs and provide coverage to more are getting more frustrated by the day. Even our own state government has thrown up their hands and said they cannot effectively implement the changes required by law and will option out of state healthcare exchanges. I'm troubled and disappointed that the Affordable Care Act will not be able to deliver on the promises our federal government made to the people when this national legislation was passed. What could have been beneficial landmark legislation may ultimately wind up being too cumbersome to effectively be implemented. Plus, this does not foresee the disruption to our providers like doctors, clinics, hospitals, or the historical delivery system of thousands of agents and brokers throughout Ohio, let alone the nation. Our chamber has been working to help educate our employers and develop alternative plans for ill-fated exchanges. However, time is of the essence as much will start to be implemented this coming January, yet our federal government has yet to prepare enough in advance. The term Affordable Care Act may become an oxymoron, and care may not be very affordable to many.